Our work has been to explore the experiences of women who are engaged in drug and alcohol treatment across the West Midlands. And it's based on research that we've conducted in partnership with Expert Citizens CIC and Centre for Justice Innovation. We found that women very much experience the stigma of the lying drug addict, and as a result they're constantly having to prove themselves, and this can create quite significant social harms to the individual and emotional harms too. Particularly, we're mindful that for one woman, she was not believed when she said that she hadn't used drugs because of a urine sample, when actually it was a mistake from the professional, and that could have resulted in her losing her child. Another woman, she wasn't believed when she reported that a police GP had sexually assaulted her, and that led to her questioning herself and feeling very down about the situation. So we have these kind of scenarios where we're therefore as academics and researchers encouraging other professionals to think about how they interact with women and how they believe what women say to be true, with recognition that women in recovery are working really hard to prove themselves lots of steps on the hurdle. So we want our professionals to be trauma informed, and we want them to reflect the core conditions of unconditional positive regard, empathy and congruence as well. As a result of sharing our findings with partners across the West Midlands, we've had some sign up from public health teams to ensure that there's women-only services for treatment, which is a fantastic outcome, and we're hoping that more public health teams do that in response to this research. Another fantastic outcome locally is that Staffordshire Police invited us to do some podcast training for their custody staff to ensure that the custody suite in Staffordshire is more trauma informed in the approach of working with women and drug users more broadly. So that's a great outcome that we're starting to see, and we hope to build on that and roll that out more nationally.